enter in the room, wash my hands. I'm going to go ahead and introduce myself. Good morning, Mr. Navas. My name is Samantha. I'm going to be your nurse today.
Morning, Miss Samantha.
All right. And can you go ahead and tell me your name and date of birth this morning?
Yes, my name is Louis Navas, and my date of birth is February 21st, 1995.
Okay, that matches with the wristband. And do you go by Louis?
Yes, ma'am.
Okay, perfect. Louis, can you please tell me where you are?
The hospital.
Okay. Do you know what state you're in?
Yes, Florida.
And what year is it?
2020.
Okay. Patient is alert noted to person, place, and time. Okay, Mr. Lewis, do you have any allergies at all that we need to know about?
No, ma'am.
Okay, I'm going to verify that with the chart. And no allergies to latex?
No, ma'am.
All right, perfect. Matches with his chart. Patient has no signs of distress, and both sides of the body are symmetrical. Patient is alert in orange times 3 as stated before. Mr. Lewis, is it okay if I go ahead and check your IV line?
Yes, ma'am.
Okay. Have you noticed any swelling at the site?
No, ma'am.
Any pain or tenderness?
No, ma'am.
Okay. Site is clean, dry, and intact. It is flushing well. There's no kinks in the tubing at all. The line is appropriate. I'm going to go ahead and verify with the provider's order that the IV is in the correct spot. And I'm going to go ahead and make sure the correct medications are flowing through the IV per the provider's order. Everything matches up. If the patient were to have a Foley catheter, I would go ahead and assess that at this time. Okay, Mr. Lewis, I'm going to go ahead and assess your hair and your scalp. Is that okay?
It's fine.
Okay. Hair is clean and neat. The scalp has no signs of any breakdown. There's no rash present. Skin is warm and dry. The color is normal for the patient. I'm going to go ahead and check the skin turgor. No tinting present. The capillary refill is less than 3 seconds in both the hand and the feet. The skin on the legs is also smooth, warm, and dry, and the color is normal for the patient. All right, Mr. Lewis, I'm going to go ahead and take a look at your ears. Is that okay?
Yes, ma'am.
All right. Ears look great. There's no rashes or lesions present. I'm going to go ahead and have you look at me. All right. And can you follow my pen light? Very good. Thank you. Pupils are equal, round, and reactive to light. I'm going to go ahead and take a look at your eyes with my hands. Conjunctiva is pink and moist. The sclera is white. There is no drainage from your nose. Your mucous membrane seems intact and moist. Can you please open your mouth and stick out your tongue for me? Very good. Mucous membranes are pink and moist. And I'm going to go ahead and have you smile. Perfect. The patient's face is symmetrical. Upon examining my patient, he does not seem to be in any respiratory distress. He is not using any accessory muscles to breathe. Mr. Lewis, are you having any trouble breathing?
No, ma'am.
Okay. And are you having any chest pain?
No, ma'am.
Okay, great. I'm going to go ahead and listen to your lung sounds. When you feel my stethoscope touch your skin, I want you to take a nice deep breath for me. If you feel dizzy at any time, please let me know and we'll stop and take a break.
All right.
I'm going to lift your shirt up. Lung sounds are within normal limits. My patient does not have an incentive spirometer. If he did, I would go ahead and teach him how to use it and have him demonstrate back how to use the incentive spirometer. Okay, Liz, I'm going to go ahead and assess your cardiac system, and I'm going to go ahead and start by palpating your carotid arteries one at a time. Very good. I'm going to go ahead and check your radial pulses and your pedal pulses. Very good. All pulses are palpable. The throws are felt. I would then go ahead and palpate the PMI located at the fifth intercostal space, the mid-clavicular line. There are no lifts or heaves noted. I'm now going to listen to your carotid pulses, okay? Good. There's no bruise noted. I'm now going to listen to your heart sounds, and I'm going to let you know where I'm going to listen before doing it. We're going to start at the aortic, which is at the second intercostal space, right sternal border. Then we'll move to the pulmonic at the second intercostal space, left sternal border. Then we'll move on to Erb's point, which is at the third intercostal space, left sternal border. Then down to your tricuspid, which is at the fourth intercostal space, left sternal border. Lastly, we'll go to your mitral, which is at the fifth intercostal space, mid-clavicular line. I'm going to listen with both my diaphragm and my bell. There is a regular rating rhythm throughout with no extra heart sounds. Okay, Lewis, now I'm going to go ahead and assess your GI system. Have you had any nausea or vomiting?
No, ma'am.
Okay, and when was your last bowel movement?
Last night.
Okay, was it normal?
Yes, ma'am.
Any diarrhea?
No, ma'am.
Okay, great. Do you have any dietary restrictions that we need to know about? Okay, perfect. I'm going to have you go ahead and lay on your back, please. I'm going to go ahead and inspect your stomach. Upon inspection, the stomach is normal and symmetrical. I do not feel any pulsations. I'm now going to listen to your stomach in all four quadrants. Bowel sounds are present and active in all four areas. If I did not hear any bowel sounds, I would listen to all quadrants for 5 minutes. I'm now going to go ahead and listen to your aorta using the bell of my stethoscope. No bruise were noted. I'm now going to palpate your abdomen. Please tell me if you have any pain or tenderness while I push. Any tenderness?
No, ma'am.
Okay, I'm now going to do a deeper palpation. Please tell me if you have any pain or tenderness. Any tenderness?
No, ma'am.
Alright. No tenderness, scarring, or mass is noted. Okay, Lewis, I'm now going to go ahead and assess your GU system. Have you been having any trouble urinating?
No, ma'am.
Okay, and have you been urinating more frequently?
No, ma'am.
And how often would you say you urinate on a daily basis?
About 5 to 6 times.
Okay, and when was the last time that you urinated?
Like 2 hours ago.
And that was normal?
Yes, ma'am.
Perfect. I would then go ahead and monitor the intake and output for the patient. Alright, Liz, have you experienced any swelling, numbness, or tingling in your extremities?
No, ma'am.
Alright, I'm going to go ahead and have you squeeze my fingers, please. Thank you. And don't let me pull against your feet. Very good, and I want you to push on the gas pedal. Very good. Strength is 5 out of 5 on all extremities. Okay, Lewis, that completes the assessment. Your bed rails are up, and your bed is in the lowest position. This is your call light. Do you know how to use it if you need me?
Yes, ma'am.
Can you please demonstrate to me how you call if you need help? Perfect. Is there anything else I can do for you at this time?
No, ma'am.
Alright, please don't hesitate to call me if you need anything. Thank you for allowing me to do your assessment this morning. I will then wash my hands before exiting the room.